As we celebrate International Nurses Day today, we have Dr. T. Dileep Kumar, President of Indian Nursing Council, sharing his views with Dr. S.N. Mishra, an infectious disease and public health expert. He is also the Senior Technical Advisor of Health and Beyond.
Welcome everyone. Greetings from the Health and Beyond group. We observe International Nurses Day today, the 12th of May. Among us today, we have Mr. T. Dileep Kumar, the President of the Indian Nursing Council and a global leader in healthcare, who will be discussing more about nursing and the theme for this year, Our Nurses, Our Future. Mr. Dileep Kumar, the President of the Indian Nursing Council, is the ex-project director of the Global Fund Program Round 7 and the ex-nursing advisor to the Government of India. He has had a long standing of 43 years of experience in nursing. He has worked in different capacities, starting as a staff nurse, nursing tutor, nursing superintendent, deputy nursing advisor, and finally nursing advisor to the Government of India. He is also a member of the Global Advisory Group on Nursing and Midwifery of WHO. In fact, he is the first nursing professional from India to become a member of the Global Advisory Committee of WHO. To his credit, he has developed many schemes and programs at the national level. These include capacity building of nursing educational institutions, continuing education for nurses and midwifery professionals, revival of nursing awards for nursing and midwifery professionals by the President of India. He has been instrumental for enhancing the budget from a mere rupees 80 crores in 2002 to more than 3,200 crores in the 11th plan in 2007 to 12. As President of the National Regulatory Body he has initiated the following activities. He has developed the Quality Nurse Assurance Model in Nursing, the National Consortium for PhD in Nursing. He has developed a one-year post-basic diploma syllabus for specialties and concept of residency format, which has been introduced. He has been part of developing modules on reaching out in emergency and development, training of nurses in HIV/AIDS. He has implemented the Global Fund for AIDS, Tuberculosis and Malaria, the GFATM project Round 7, where 1.5 lakh nurses and auxiliary nurse and midwives were trained. He has been responsible to make India a member of the International Council of Nurses. He has also signed an MOU with the BRICS Nurses Association. He has also developed the nurse practitioner in critical care as a postgraduate residency care. He has enabled and ensured the nurses registration and the tracking system, the live register. He has also been responsible to become a member of Alliance of Asian Nurses Association. The list is long. I have personally known Mr. Dileep Kumar for more than 2 decades now, and our team has had the privilege of working with him in the Clinton Foundation Training Project and the large-scale Global Fund project. Welcome, Mr. Dileep Kumar. We will now go live on this conversation. Mr. Dileep Kumar will start for the benefit of the viewers. As a senior nursing professional with decades of experience, you have seen a generation of nursing care in India and have been part of the global nursing scenario. How would you describe the changing work profile of nursing care in healthcare, whether as clinical nurses or public health nursing?
Good afternoon to all of you. Greetings from the Indian Nursing Council. First of all, I am very happy to join with you in the dialogue where the globe is celebrating the International Nurses Day on May 12th, which is a very unique to India, especially on this May 12th every year. Our Rashtrapati ji awards for the outstanding nurses and midwives, the National Award for the Nurses and Midwives. Definitely, the change of profile of the nature of the nursing practice has evolved since last 20 years. Now, earlier, we could not think of a word of a nurse practitioner word in India. So now the the syllabus for the nurse practitioner postgraduate residency program, which has been approved by the Ministry of Health and Family Welfare and the Indian Nursing Council, including the scope of practice. Though legal framework is yet to be finalized, but this program is being implemented on the basis of the institutional protocol in India. So you can imagine the way our nursing professionals working in the critical care, and also they are working in the forefront in the various specialty. We have 14 one-year post-basic diploma specialty courses, and as per the national health policy and the initiatives that we are reformatted the syllabus so that our nurses and midwives working in the clinical setting, while working in the different clinical setting itself, they will be able to acquire this post-basic diploma for their career path. So the now even in order to improve the quality of the nursing education, the recently Indian Nursing Council has revised the BSc nursing syllabus on the basis of the competency-based curriculum, and this competency-based curriculum has gone so high in the sense that the developed countries like Canada, the one of the university, Brunswick University, has recognized our syllabus for providing the dual degree. So in collaboration with the Manipal and the Indian Nursing Council, and including the Brunswick regulator also joined in this whole process for awarding the dual degree. That itself speaks volume of then our nurses can straight away can get into the Canada, and also the mutual recognition of assessment MRA in the global level. We have signed MRA with the Singapore Nursing Board so that our nurses. So there is a scope for the at the global level and also at the country level. There is a post for the community health officer has been sanctioned by the Government of India National Health Mission to be positioned at the health and wellness centers. You all know that 150,000 sub-centers have been converted into the health and wellness center, and in order to expand the role and also to provide the quality of the primary health care, they have identified a community health officer, and many of the states have preferred the graduate nurse as a community health officer. So our role has been expanded in at the community, and also the nurse practitioner program, which is again another landmark decision of the Government of India for the midwifery guidelines have been developed, and also the Lancet evidence which has been captured by the Government of India. 83% of the maternal deaths can be prevented if you have a midwifery-led unit, and who have been trained on the basis of the standards prescribed by the International Confederation of Midwives. So this evidence, global evidence, which is available, the Ministry of Health and the Indian Nursing Council jointly we developed the nurse practitioner midwifery program. Now it has been rolled out, and each state is going to have a national midwifery training centers, state midwifery training centers. So all these things are contributing, and where the WHO has said, where the without nurses you cannot achieve the universal health coverage.
Yes.
So in that perspective, the nurses and midwives are given a scope in various settings for providing the quality of the nursing and midwifery services, and also to attain the sustainable development goal as the United Nations in terms of the IMR and MMR. Their contribution is very significant. They are able to. So therefore, the scope has increased. The expanded role of the nurses and midwives has increased. They are now working at the level of the practitioners. So that is the future.
Okay, I think, thank you very much. I think this is very encouraging news. I think the expanding scope and the role of the nurses, we all know for decades now, for centuries now, that nurses have been the backbone of healthcare. And it was very evident during the COVID pandemic, where they came to the forefront to address the pandemic, not only in India, but globally. My next question would be, would you little bit elaborate on these nurse practitioners, since this is going to be the next big thing for nurses? How different would it be from the classical nursing care role of a nurse to a nurse practitioner? I mean, will it be a little different? Will be more than what she is doing at the moment, he or she is doing at the moment?
See, the all our intensive care units are and, generally, if you have a trained in the critical care, the impact and outcomes in these critical care units is much evident, is there globally. So we thought that because the yes, definitely the intensivists who are working there, they also contribute, but 24/7 only the nurses are available in the ICUs. So therefore, the internationally there is a nurse practitioner critical care program, which is a 2-year program which is available globally, and so therefore we brought that program to India. And you know that with due respect to the medical fraternity, that we had a tough time to get this get through, and we as a regulator, we have a power to prescribe the syllabi to all the category of the nurses and midwives. Since we as a nurses to work in the critical care, we have to work with the healthcare delivery system among the doctors' colleagues. So therefore, we wanted the stamp of the Ministry of Health. Therefore, we took this syllabus to the Ministry of Health, and Ministry of Health had a stakeholders meeting. In that, many of the state health secretaries and some of the selected director of medical educations were invited to that consultation, including the Director General of Health Services. We had a stakeholder meeting, and the syllabus which was prepared by the, again, no, the concept of training of the whole nursing education, the methodology has been reworked, in the sense there will not be a classroom type of a study, which generally happens in our undergraduate. So in this nurse practitioner critical care, it is a postgraduate residency program. 24/7, they will be working in the ICUs only. And I think only about 10-15% of the time they have to work, they have to attend the seminars and those things. But they are there and the logbooks have been prepared, and the syllabus has been extensively prepared. And when this was put out to the public domain, and I don't know, one of the Dr. Mehta from the UK who has gone through our syllabus, and he sent a message to the Ministry of Health. And this nurse practitioner critical care syllabus prepared by the Ministry and the Indian Nursing Council is more than the nurse practitioner program in UK. So that is the level of the comments we received. And yes, we have a legal provision is not there, but because the legal provision is likely to come, because the new Nursing and Midwifery Commission is likely to come. In that scope of practice of the nurses and midwives, including all the specialities, have been included in the Act. It is going to come in the form of the bill. Shortly, our Health Minister is going to introduce in the Parliament. Once that bill is approved, then the legal empowerment in the format of the scope of practice is going to come. But till such time, what we have been decided is on the basis of the institutional protocol, because the institution will decide what are the protocols, procedures a nurse practitioner who has undergone this 2-year program can do, what type of investigation she can order, what type of the medicines she can administer, what type of procedures she can independently do it. All these things as the institutional has come out with a protocol after a person who has undergone this 2-year residency program. We have about 35 institutions all over India is running this institution. And I think to say how best this program has made an impact, I think the MGM College, Medical College, Mumbai, and the Krishna Institute of in Karad, these are the 2 institutions. Intensivists telephonically told me they came to the rescue in this COVID-19, and these people, nurse practitioners who have been trained in critical care, they came to handy in the ICU during COVID-19. So even now, I think a lot of consultation we are taking place. Many people are doctors or intensivists are appreciating. Recently, Holy Family Hospital in Delhi also started this who is a medical superintendent, happened to be the secretary of the Critical Care Society, and he has realized this is a very important program. And I think since their training is totally in the intensive care unit, their outcomes and impacts are going to be in terms of the reducing the mortality and morbidity is going to be tremendous. So so therefore now the government of India also has realized during the recent Chintan Shivar meeting, which our Honorable Health Minister took with all the regulatory bodies. In that, I think the outcome was, I think India should start training more nurse practitioner program in different specialities. So now emergency and trauma is also has been now completed. So now we are in the Indian Nursing Council in the process of developing about 7 to 8 nurse practitioner program, because the medical fraternity has gone to the high level of MCH. So if we have to work hand in hand in the healthcare delivery system, there the general nursing is not going to be effective to give a holistic and competent care to the patient. So therefore, we have to strengthen the preparation of the nurses in these specialization, so that they will be work effectively and work as a team in the healthcare delivery system. I think this is making a big impact now. That is the reason now the ministry is telling go for more nurse practitioner program.
Thank you very much. I think these are some very encouraging news. I think all of our viewers and our health professionals and our nursing professionals would be very much motivated to hear these kind of news coming out. This year's theme for International Nurses Day is Our Nurses, Our Future. Now, with this nurse practitioner coming up and more exciting things happening, for our viewers and all health professionals, would you elaborate on how nurses can further enhance their skills, or maybe more young students, science students can be motivated to take up nursing as an attractive option, career option, and can contribute to healthcare and overall development, linking to the sustainable development goals?
Globally, at least for the nurses and midwives, is a very encouraging decade. I am going to put it in this 2020, the World Health Organization in the World Health Assembly declared the International Year of the Nurse and Midwife. You can imagine World Health Assembly declaring 2020 as the International Year of the Nurse and Midwife. And coming out for the first time, World Health Organization, the State of the World Nursing Report. It's called SON Report, State of the World Nursing Report. If anybody is interested in to go into the whole report, our Indian Nursing Council website, we have that State of the World Nursing Report. For the first time, WHO has come out with this report. It has captured the how nurses' contributions are making an impact in the healthcare delivery system. A lot of evidence has been captured in that. This was come out because the Lord Nigel Crisp, who has happened to be the ex NHS secretary of the UK government. So he was knowing that how the nurses and midwives contribution in the UK is making in their NHS. So therefore, he took this initiative to the International Council for Nurses, that is ICN, and the WHO to celebrate 200-year birth anniversary of the Florence Nightingale, who is the founder of the globally the modern nursing. So when he took up this initiative, rightly a right person took this initiative to the WHO and to the ICN, and that's how they declared. Unfortunately, this euphoria, our nurses and midwives globally could not celebrate due to the COVID-19. Because immediately the COVID-19 came in, and at least this gave an opportunity for the nurses and midwives globally and also in India. The visibility of the services of the nurses and midwives in the eyes of the public has increased. Everybody knows how our nurses and midwives were forefront in taking care of the COVID-19 patients who are not been touched by their own kith and kin, how they were day in and day out. They were working with the COVID-19 patients, knowingly they are going to get the infection. So such an opportunity gave during this COVID-19. And this again, Sohn report also gave a big opportunity for the future decade, for the future, our young students should be able to realize how important it is. So they came out with a very resolution in the World Health Assembly, resolution called Strategic Direction for Nursing and Midwifery 21-25, SDNM, because the WHO works for the 4-year cycle, and 21-25, the resolution is Strategic Direction for Nursing and Midwifery. The theme of the resolution is, I think the WHO gave a call to all the countries. One is the investment. So the WHO is telling to the countries, you have to invest money for the nursing by the governments. The second theme, which has been V1 in this report, is the creation of the positions. I think optimum nurse-patient ratio, which is there will have an impact and outcome for the patient outcomes. So it is advising all the countries, you create the positions. Then the third is leadership. They said the nurses working in a clinical units in different wards, she acts as a very good leader. She has to coordinate the services of the interprofessional team. So therefore, she will be one of the only person available in the ward which is taking the leadership role. So therefore, they have realized there is a need to train the nursing and midwifery professionals in the leadership skills. Maybe leadership skills at the clinical units, at the hospital head, and also at the state level, and also at the national level. So the leadership is one of the things which has been emphasized in this theme. And fourth is the service delivery. I think you have to create a conducive atmosphere, environment, and also working conditions for the nurses to work effectively in the healthcare delivery system. So these four themes, at least music to ears to me, because our nursing fraternity is always looking for these the four themes. So now this resolution has been shared through the WHO to all the countries, and now I think they are going to ask the feedback in 2025. And also World Health Assembly, for the first time after 10 years, the agenda of nursing and midwifery came in 2021. So that itself speaks volume at the global level. So I think globally, they have estimated about, when the report was published, 7 million nurses need to be trained, and about 1 million midwives. So but after the COVID, again, they have come out with another, because a lot of countries where the age, they are in the their advancing age as a nursing and midwifery professionals. So many people are retiring, and also many people have left during the COVID and all. So now again, International Confederation and Midwives, and also International Council for Nurses, they have made a reassessment after the COVID. The global shortage is something like about 10 million. So, so therefore, a competent nurse and midwife with the latest syllabus what we are preparing, and latest what the Canada is able to provide the dual degree. So there is the enough scope. Even the government of India is telling that we should attract more students to India, because there is a lot of overseas students who would like to come to India. So we have a best infrastructure which is available in India, should be best utilized. So therefore, we have taken a policy decision that for overseas students, if they have to do a nursing and midwifery in India, we have made a policy relaxation that 25% of the seats we have earmarked for the overseas students in the existing medical colleges or the 300-bedded hospital attached to School of Nursing. So that type of a policy has been announced, that to attract more students, so that we'll be able to overseas students can come and study. And also with this new syllabus and all, they will get a better opportunity to go to the developed countries where the greener pasture is available. And also the Ministry of Health, NHM, has also taken a very policy decision that 84,000 nurse practitioner midwives are going to be trained, and they are going to have a midwife-led units. So these are all for the future students, that the career path is being worked out. And so therefore, the future, at least in this decade, for the future for the nursing and midwifery is very bright.
Thank you very much. I think as you rightly said, to sum it up, this is going to be a decade for nurses and nursing care. And it definitely with your, as I've seen you with your dynamic leadership and your experience, I think nursing profession is very well positioned to become global leaders. At least India is going to become a global leader in nursing, if not already. And we definitely would like many other people to take up nursing as a very attractive option and profession, because it's an expanding, growing profession, where, as I said, the scope of work is expanding beyond regular nursing care. Mr. Dileep Kumar, it has been a pleasure talking to you. It has been very encouraging to hear some of these exciting things that are there in the future. Before we part, any final comments to all our nursing professionals across the country and globally across the world?
I think I'm very happy to be part of this your initiative, because Dr. Mishraji and myself worked very closely in the GFATM project. As I said, it's a decade of the nurses and midwives. In my personal perspective, there is enough opportunities which are available to us. It all depends how competent you are. So therefore, our training should be competent, and to focus on that competency, we have brought the state-of-the-art simulation center to India. I think we have a national referral simulation center. We worked very closely with the JAPAGO and the Lateral and the Indian Nursing Council and SGT University. We have brought out because there is an international published studies available in the United States, that 50% of the time for the baccalaureate for nursing program can be implemented through simulation. So therefore, to become a competent, this type of simulation, they can make any number of errors during the process. Briefing and debriefing will make them to have a good learner, and also the competencies can be improved. So therefore, we are now propagating more on a simulation. I think future of the medical education and nursing education is going to be simulation, so that we can prepare the competent the nurses and midwives. So therefore, our training, if you are competent and if you are the avenues of opportunities are plenty. So therefore, in India, there is enough scope for the nurses and midwives, and the way the healthcare is expanding, and now health is one of the talked subject, and governments are making more investments for the health. So therefore, the nursing is happened to be the 24/365. So therefore, the requirement and opportunities are plenty. It all depends how we are competent enough to take this challenge. Thank you very much.
Thank you very much, Dr. Dileep Kumar. From Health and Beyond Group, we would like to acknowledge and thank you for all your cooperation and the time in sharing your views. I'm sure our viewers and our nursing professionals and medical professionals would have been very much enlightened by this conversation. We wish you the very best for the International Day of Nurses, etc. Thank you very much for your time. Thank you.